Welcome back. Around 75,000 women in India die each year of cervical cancer. In a significant move to tackle this form of cancer, India will launch an extensive human papillomavirus HPV vaccination campaign targeting girls in the 9 to 14 age group. Now, this immunization drive will unfold in 3 phases with over 7 crore doses prepared for the initial stage. Now, cervical cancer currently is the second leading cause of cancer among women in India. It's poised to become a major focus of the government's immunization program. The WHO ranks cervical cancer as the 4th most common type of cancer globally, and it has emphasized on the urgency of preventive measures. But how important is this vaccine, and why is it important to address rising cases of cervical cancer in India? To talk about this, we have with us Dr. Gayathri D. Kamath, Senior Consultant, Gynecology, Fortis Hospital in Bangalore. We have Dr. Geeta Kadiaprath, who is a Senior Surgical Oncologist in Max Hospital, and Dr. Sarika Gupta, who is a cervical cancer consultant in Apollo Hospital. Let me go across to Dr. Kamath first. Ma'am, please tell us how alarming is this prevalence of cervical cancer, and what is the importance of this vaccine, of this free vaccine that is being thought about right now?
Yeah. Now, cervical cancer is a big cancer. It affects a good number of Indian women. If we look at the global data, India contributes a significant 21% load of cervical cancer. And if we look at the cervical cancer deaths, 40% of deaths unfortunately happen in our country. So the burden of cervical cancer is huge. We need to understand that cervical cancer is caused by infection with oncogenic strains of a virus, which is the human papilloma virus. And now, with this vaccine available, we can adopt strategies to prevent HPV entering the human body. This vaccine is a prophylactic vaccine, meaning to say this has to be given before the virus enters the body. If this vaccine is given, it creates an immune response, so much so that when the virus enters the body, it doesn't enter the cell. There are certain neutralizing antibodies which prevent the very entry of the virus into the cell. So if the virus doesn't enter the cell, a woman cannot get cervical cancer. So this vaccine is indeed a breakthrough, and it's going to be a big step in overcoming the cervical cancer burden. It's very important to understand that we need to give this vaccine even before the virus gets into the system. And that is why it is devised to give these vaccines to the young girls around the age of 9 to 14, because this is precisely when their immune system is naive and it's not affected by the virus by and large. And giving it at this point of time, the virus doesn't enter the body, and we are overcoming a huge impact of cervical cancer. So it's important to give the vaccine at the right time. And we need to understand it's a prophylactic vaccine, needs to be given much before the virus enters the body, and it gives immense benefit.
So the vaccine has to be given before the virus enters the body, and that sort of explains why girls in the age group of 9 to 14 are to be administered this virus. And of course, we'll get to what can older women do. But Dr. Geeta, tell us, what happens in the early stages of cervical cancer? As often I hear from experts that there are no symptoms, and it's only longer a woman has cervical cancer without treatment that more likely is she to show symptoms. What are the symptoms of later stage cervical cancer, and how does one get to know, and do we have studies to show what are the factors that lead to this?
So the good thing about cervical cancer is that it gives you a chance to pick it up at a point when it has not done damage. So I think that is the important thing to understand. And the vaccine, like Dr. Kamath said, prevents it from happening. But then there has been the technique of pap smear, which allows you to pick up these abnormalities and take steps before this actually goes on to becoming an invasive cancer. So we don't want to get to the advanced stages, but unfortunately that is how we get to see patients even today. And usually the presentation is that there is foul-smelling discharge. There could be bleeding, there could be intermenstrual bleeding, there could be bleeding and pain at the time of intercourse. So these are the usual symptoms of cervical cancer. That is how it presents. And a lot of times you tend to ignore it and neglect it. And by the time that you figure it out, it is already advanced. So the risk factors, well, the risk factors, the multiple sexual partners, poor hygiene. These are the common issues that give rise to, allows for this virus to home in and then create problems. So that is what we need to address. Fortunately, in our country, the incidence of cervical cancer is falling, but not at the rate that we would want it to. And I'm sure this vaccination campaign is what is going to really help us overcome this problem.
Right.
As of today, the uptake of the vaccine is really dismally low, close to less than 1%, in fact. And I think the vaccine is what is going to solve the problem of cervical cancer, which can be quite devastating in the sense that it tends to affect younger women with young families.
Right. Dr. Sarika, tell us, so what happens to the older women? What is also the importance of screening? Is there a way that older women can also get immunized? Because as we saw both Dr. Geeta and also Dr. Kamath explain how important it is, and because this is a virus that affects younger women. Also explain to us the importance of regular pap smear tests, because every time we go to a doctor, this is one thing that they insist on. Is that something that will be helpful here?
So as till now we have spoken about that it is the most beneficial to girls between 9 to 14. So once a girl has passed her 15th birthday, then they can take the vaccine till the age of, I think, 26. It's if they have lost earlier, then didn't have the opportunity to take the vaccine, they can still take it, but they will need more doses. They will need a booster's dose. As per WHO, they'll need 2 doses of HPV vaccination in comparison to only 1 dose for somebody who is less than 15 years. Now, their vaccine can be given to older women too, but the effectivity is less in older women as they develop a poor humoral immunity against the virus. And the second thing is that mostly the women are already infected with HPV after sexual intercourses or sexual activity, and once they already have a persistence of HPV in their cervix, the vaccine wouldn't be that beneficial. Now, talking about the screening, so every woman after the age of 25 should get screening, and screening can be done in now by 2 or 3 ways. In a resource-limited setting, like in rural areas where the incidence of cervix cancer is the highest and the availability of pap smear is low, there even visual inspection of the cervix by a health worker can be done, where we are teaching in our institute also to the health workers how to visualize the cervix and tell this is a abnormal cervix. Right. And the second,
yes, no, Dr. Kamath, quickly I wanted to also understand how important it is to universalize the distribution of this vaccine, because it's already available at ₹2,000, but making it free would make a big difference, isn't it?
Definitely. It's going to be making a remarkable impact in the, acceptance, because cost has been a marring factor so long, but then making it available free for all girls across different socioeconomic strata will be a big leap in, reducing at least the acceptance. And I think we are more likely to get more and more girls and women vaccinated. So this is a definite breakthrough, and I'm very happy. It's a big day for India.
Right. Thank you, Dr. Kamath. Thank you, Dr. Geeta. And thank you, Dr. Sarika, for joining us on this discussion. Clearly, cervical cancer numbers, are growing in India, and it's important that the government addresses this. The government is all set to roll out this immunization campaign, which will target girls from the age group of 9 to 14. It is also starting this awareness campaign to encourage more older women to screen for screening. Time for a short break. More news and updates on the other side.